Hi, I'm Dr. Jeffrey Thaxton, a board-certified plastic surgeon. Thank you for tuning in. I'm going to discuss with you implant durability. There is a common misperception that I hear very frequently that my implant should be replaced every 10 years. Well, that's not based on any scientific evidence. The reality is that breast implants will likely give you 20 to 25 years before they develop any mechanical issues. That's not to say that they can't develop a problem early in that, but that's usually not the issue. With saline implants, if they develop a mechanical problem, it usually is that it develops a small leak and gradually the saline leaks out of the implant and gets absorbed by your body, which is perfectly harmless. It's what your body's mostly made up of. When the saline implant leaks, the breast deflates and it becomes obvious that there's a problem. And you can come in and discuss the issues and we can come up with a solution for fixing the problem. With silicone implants, the problem is a little bit more difficult to detect. Silicone implants are filled with a jelly-like substance that generally doesn't leak out, so that you may have a small hole in the shell of the implant and not know it, and possibly not know it for years. Because of that, the FDA recommends having an MRI 3 years after the implants are placed and every 2 years thereafter to check and see if there is a leak in the implant. However, the reality is that your silicone implant, just like your saline implant, will likely last you 20 to 25 years before you need to have anything addressed due to a mechanical problem with the implant. So if you have any questions about implant durability or other questions about breast augmentations, please don't hesitate to call and I will be happy to discuss this with you. Thank you for tuning in.